Are you or someone you know thinking about filing for disability benefits, unable to work because of their disability? Are you receiving Social Security disability benefits? Well, this video is for you. We're going to do an insider guide to all things Social Security disability. Who am I? My name is Ed Weir. I ran the third business Social Security office in the country, and I've helped hundreds of thousands of people actually file for disability benefits on the inside. I've taken hundreds of thousands of disability claims. So I'm going to give you all the tips, tricks, and secrets from the inside of how to get the benefits and keep those benefits. And if anything type of new updates coming down with the new administration, we're going to keep you up to date on all of that. And I've got a brand new free resource here. Let me go ahead and pop up the brand new free resource. So this is my website. It's mygovexpert.com. Let me go ahead and put the link down there. So I'm going to talk about all things DIB, disability and Social Security. The acronym we use is DIB, disability insurance benefits. Show you where to find particular resources, information, details, calculators, and all the rest of it for all things Social Security disability. And then I'm going to open it up to questions because people always have questions. Okay, so you first get into it through mygovexpert.com. And then once you're there, I've got different sections on retirement, disability, survivor, Medicare. I've added some new sections on overpayments, living overseas, veterans benefits, Social Security cards, appeals, Medicaid, all the rest of it. So let's go ahead and stick to what we're talking about today is the disability part. All right. So let's go through here. So it's broken down into tabs, the entire page for easy access. And if you're looking at this website and you saying, hey, this needs to be explained a little bit better, you forgot to mention this, or could you explain this a little bit deeper? Then all you have to do is click on that little button there and share your thoughts. You can support our mission there, donate, subscribe. I think the subscribe button is not working today, so I have my guide. Check that out. But all right, so this is an ongoing project. This website is being updated pretty much every day. Okay, so for disability benefits, there's two types of disability benefits as Social Security administers. It's SSDI or SSI. So here's the differences. SSDI, Social Security Disability Insurance, that's what you actually, when you pay your FICA taxes, you pay into that, for retirement or spouse benefits or surviving spouse benefits or disability benefits. And then SSI is the welfare-based program, the needs-based program that Social Security administers. It's low income, low resources. You have to be disabled or 65 and older. So these are two different programs. Can some people get both SSI and SSDI? Absolutely. You can get both. It really depends on how much your SSDI is, because in terms of SSI, the max you can get this year is $967. And I have finished writing the SSI part. I'm going to add an SSI part that deals specifically with SSI and how to keep that and incomes and resources and recertifications. So on the More tab there, watch for that to come up in the next week or so. Okay, so there's Social Security disability. What types of disability? It goes in through it. If you are unable to work, people ask me all this time during the live Q&As. They say, well, I've got this disability, I've got this disability. Will I be approved? It really depends. Again, I've taken hundreds of thousands of applications, and I'm a doctor, but I'm not that kind of a doctor. I've seen some that were approved. I'm like, that's interesting. I never thought that would be approved, but I'm not a doctor and I'm not a medical doctor. And some that were denied where I was like, wow, that's strange. I don't think that should have been denied. But so it really depends on the situation. So if your disability prevents, whatever your disability is, if your disability prevents you from working, then file for disability benefits. And maybe one particular disabling condition won't qualify you, but maybe the medication you have to take to address that issue, qualifies you as a kind of a package, I guess, a disability, kind of different. You've got this main issue and this other issue and this other issue and this other issue. You got these 3 or 4 or 5 things. Putting together all those disabilities just might get you approved. Okay. One thing a lot of people don't realize is that in order to get Social Security disability SSDI, you have to fulfill two insurance requirements. You have to be insured. That means you actually paid into Social Security for at least the 10 years, less if you're younger. But you also have to be what's called currently insured based on recent work. You had to pay into Social Security, disability, FICA taxes 5 out of the last 10 years, any of the 5 last 10 years. So you had to be insured and currently insured. So you can definitely check out those. And then different categories for ALS, ESRD. All right. What about benefit calculations? So benefit calculations are different for SSDI versus SSI. And then I've got all the details in there and how it's calculated, how the sausage is made. How does other income affect your SSI? It tells you that. In terms of other income and your Social Security disability insurance, no effect whatsoever. So if you're receiving some type of royalties or something like that, an inheritance of $1 billion, and you're receiving Social Security disability insurance, doesn't affect it. The only thing that will affect SSDI is workers' comp, public disability benefits. So I've got a very, very, very long Q&A on workers' comp. If you have kind of private disability insurance, that doesn't affect your Social Security disability insurance. It affects your SSI, but not your SSDI. But workers' comp, public disability benefits does. So that's why I've got a very, very, very long Q&A about that, how that's calculated, why it's calculated, and all the rest of it. Okay, what about the application process? How do you file for benefits? What happens when you file for benefits? I put down here 3 to 6 months. I need to update that. When I was taking disability claims, everybody was taking disability claims at that time. We used to tell people 3 to 6 months to get your decision. Social Security is at a 50-year low in terms of staffing. That was even before Doge and the new administration came in. So Social Security employees were telling people 6 to 9 months to get a decision, but now all bets are off. How do we make that quicker? Contact your politicians and tell them to support Social Security and say, hey, this is completely unsatisfactory that someone has to wait a year, 2 years to get a decision on their disability. So, and then it also goes into a medical versus technical denial. Again, a technical denial would be, if you're not currently insured or you're not insured at all. And then there's medical denial. It goes into all the details. People ask me all the time, what about I'm 62 years old. Can I still file for benefits? Yes, you can still file for disability benefits. And one thing I need to take from another section there on retirement, I've got the question in retirement. But I need to add that into, you can file for retirement and disability. I need to cut and paste this into the disability portion because it applies to both. You can file for retirement benefits and disability benefits at the same time. You will only get one, but why people do that is because disability to get a decision takes forever and people just can't wait. So if you're 60 eligible for survivor benefits, you can go ahead and start your survivor benefits while you're waiting for disability benefits. If you're 62, you can file for benefits on your own record and start getting those checks coming in until they make a decision on your disability claim. And it does, obviously, when you take your Social Security retirement benefits early, it does reduce your benefits a little bit. So definitely check that out. I've got some particular examples there. So you can find that on the retirement section. But like I said, I will cut and paste that and put that into the disability section as well. So this was based on more recommendations from y'all. So any type of recommendations, make sure you click it in there and tell me what you want added, and I'd be more than happy to do that. Okay, so, and the application process, the most important thing is to start the process. Do not wait. If you are unable to work because of your disability, start the process. Don't say, well, when I go see my doctor next month, after I do that, then, I get medical records or whatever, then I'll go ahead and file. No, you just lost a month of time. You just lost a month. So call Social Security, file for benefits. I always recommend doing it online. Why? Is because you've got a lot more time to do it, to get your prescriptions and your doctor's names and addresses and all that kind of information sit, right there on your desk. Get your cup of coffee and then go through the application. That way you're not pressured. The problem doing it with an actual Social Security employee is that they've got no staff. So they have to rush everybody now, which is completely unfair to you, but that's the reality. So reach out to your politician and say that's unsatisfactory. So you can do it on online, and then make sure you get all that information. And what happens is a Social Security employee in your local Social Security office reviews it. If there's anything that needs to be addressed, they will call you up and say, hey, what about this? What about that? What about this other thing? If everything is cool and copacetic, they will send it up to what's called the Disability Determination Service. And that is a state agency that actually gets all the proofs. And you don't necessarily have to provide medical evidence. The agency gets that. When you file for your disability, you sign or electronically sign what's called an SSA 827, Authorization to Release Medical Evidence. And then the Social Security Administration, the DDS, uses that to contact your doctor, and your doctor sends all the medical records, hospitals, clinics, or whatever the case may be. So that's pretty much, so you can go into the details. I give you a lot of information on what is a consultative exam. What if you go back to work? What is compassionate allowance, a terminal illness called a Terry case? Those are really expedited. The internet myth out there that everybody is denied for disability the first time, please stop repeating that myth, because it really hurts the people that want to file for disability. They've got other issues, and they say, well, my life is that I've got this disability, I lost my job and all this, and if I'm just going to be denied, I just can't handle that. And they just don't file. So let's stop that internet myth. I have had so many cases that, particularly Terry cases, that taking the application at 9 o'clock in the morning, by the end of the day, they were approved. So the next day I walk into the office, they're approved. So yeah, we need to stop that myth. A lot of people lawyers usually perpetuate that myth because they want you to use a lawyer. Do you need a lawyer? I talk about that in here, but if you want a lawyer, go for it. I personally, based on my hundreds of thousands of times to do this, the first initial claim, you can usually do it yourself, because if you're approved, then you have to pay the lawyer 25% of back pay, or $9,200 this year. And for the initial and the next step, the reconsideration, the next level appeal, you basically do what the lawyer does, and the lawyer asks you questions. And if you file online or get with a Social Security employee, they ask you the same question. So why spend $9,000 to do basically the same thing? If you're denied the second time and you have to go to the administrative law judge, then yes, I definitely recommend a lawyer. And I always recommend local lawyers because they know the local judges and everything like that, kind of avoid the big, national sweatshop type. Well, okay, I apologize. Lawyers out there, don't sue me for saying sweatshop. But anyway, all right. So what about, and this goes, the next little tab there goes into the appeals. So you've got your initial claim, and then if you're denied, you can go to your reconsideration, hearing, appeals council, federal court. And then I give all of the details, and again, whether you need a lawyer there or not. Continuing disability reviews. These are for people once you're approved, and all those people out there, if you're approved for disability, you know about those CDRs. And my philosophy on CDRs is FCF. Forget about them, complete them if you get it, and then forget about it again, because CDRs are budget driven. If Congress gives Social Security Administration money, then the Social Security Administration can do a CDR. If they don't give them money, they can't do them. So even if it's your time, you're like, oh, next month I'm supposed to get a CDR, continuing disability review, and you're freaking out. But your local office doesn't have the money to do it, so they won't do it. So don't worry about it until you actually get it. And when you get it, then complete it. And I've got tons of information, long form, short form, who receives it, what happens, tons of information on CDRs. But don't sweat it until you actually get it. Social Security does a really good job of freaking people out about CDRs. Don't worry about it until you go out to your mailbox and there's a CDR package in there. Then come back here and get insider tips, tricks, and secrets on how to fill all that information out. But until then, don't sweat it. You've got more important things to worry about, your health and all the rest of it. So, hey, if you need help with Medicare, Medicare Advantage, Medicare supplements, Part D plans, make sure you reach out to my partners at Chapter of Medicare. I looked for a place that would help y'all out, and Chapter Medicare knocked it out of the park. They've got excellent customer service. They look at every single plan in your area, and their help is always 100% free. Give them a call and they'll see if they can help you out, and tell them Dr. Ed said hi. Working and benefits. Can you work and collect Social Security disability benefits? Absolutely, you can. And a lot of people get in trouble because it's all very, very difficult. So I've come up with a kind of a printable, you can print this out, a guide. Step 1, the trial work period. Step 2, the extended period of eligibility. After the EPA, the EXR, all of it. What about Medicare? All the rest of it. So that's a nice long, but I think it's a lot easier to follow than a lot of official SSA type stuff. And then also I've got a nice little calculator in there so you can see what the trial work period is and get an idea if you're allowed to work, which you are, because Social Security, Congress has determined they want people to go back to work. If you're on disability benefits, if you can go back to work, then more power to you. It's good for you. It's good for the economy. It's good for the Disability Trust Fund. It's good for everybody if you're able to go back to work, So that's why they give you this trial work period and all these other work incentives. So, but if you can't do it, you can't do it. And that's it. What about Medicare and Medicaid? Obviously, with Medicare, if you're on disability benefits, you're entitled to Medicare after being on disability for 24 months. Medicaid is a needs-based program. And again, I've got a section up there on Medicaid that goes into Medicaid, what it is, how you can become eligible, the income requirements, and all the rest of it. So definitely check that out. In terms of Medicare, once you get your Medicare, you have to determine how you're going to cover the gaps of Medicare. It's either through a Medicare supplement plan or a Medicare Advantage plan. Unfortunately, in most states, if you're on disability benefits under the age of 65, you're only going to be able to get a Medicare Advantage plan. So you can contact my partners there at Chapter Medicare, and they can see what's going on in your particular neck of the woods and find the best plan for you. Once you turn 65, then nobody can deny you whatever your pre-existing conditions are for a Medicare supplement plan. But usually under 65 in most states, all you can get is a Medicare Advantage plan. So if you're able to get a Medicare supplement plan, always look at those first. I always recommend Medicare supplement plans first. But if they just don't work for you for whatever reason, then check out a Medicare Advantage plan. You just have to, takes a little bit more effort to keep up on that. All right. So, and then I've got another section there on other types of frequently asked questions. Can children receive what happens Medicare coverage? So you can get disability benefits at any age. Someone asked already here today whether they can get disability benefits on somebody else's record. Yes, there are two situations. If you're a disabled child, you can get it on your parent's record. If you're called a DWIB, disabled widow, you can get disability benefits on a deceased spouse record. But you have to be between the ages of 50 and 59 to get disabled widows benefits. So I've got a section on that as well. All right. So that is it. So if you've got any questions, make sure you just click on that little suggest thing there and say, Ed, you need to explain this a little bit easier, and you need to add this, and there's a typo here, or whatever the case may be, and I'd be more than happy to fix it. So, and then you can also always support our mission to make sure all these resources continue to be 100% free for y'all.